Welcome to the press conference for the Board of Education Unions Coalition. My name is Mary Jordan. I'm a vice president of the Pre-K-12 Council of AFT. I'm also the president of the Norwalk Federation of Teachers. I'm here to represent certified educators across the state of Connecticut affiliated with AFT. We are library media specialists, school psychologists, school counselors, educators of all subjects from pre-K to 18 to 21 programs. I join with the Board of Education Unions Coalition, who demand that the state of Connecticut maintain, enforce, establish, rigidly enforce consistent statewide protocols for safety in all schools. We find that the level of risk in our schools can be unacceptable, and it greatly varies from what was promised last fall. This petition represents an unfortunate last resort. No one is pleased or satisfied at signing this petition, but it represents the feelings and interests of over 14,000 educators and support staff across the state of Connecticut, teachers, school employees, and parents who feel that the governor and the Department of Education have turned a blind eye to the health and safety of students and staff. Before delivering the petition names to the governor's staff, you will hear briefly from 5 fellow union leaders. Each will address a different element of the crisis and our solutions from the Safe and Successful Schools Now report. I'd like to ask the press to hold off on any questions until all 5 have spoken, and then we'll take questions before we deliver the petition. First up is the president of the Connecticut Education Association, CEA, Jeff Leake. Jeff, thank you for being here.
Thank you, Mary. Thank you for being here as well. My name is Jeff Leake. I'm the president of the Connecticut Education Association, but the hat I wear today is that of an educator, not necessarily or only as a union leader. We represent over 40,000 active and retired teachers across the state of Connecticut, and I am here on their behalf. This year, when COVID-19 closed our state school doors, the outstanding skills of Connecticut's public school educators and staff were clearly on display. Without any helpful guidance, direction, or leadership at the federal level, Connecticut's educators worked hard to maintain consistency and compassion for our students. We have continued that dedication at great risk to our educators and the families, as many of Connecticut's dedicated educators are going to work every day amid massive COVID outbreaks and unsafe working conditions. While tighter restrictions and protocols have been established elsewhere, educators who are doing their best to deliver quality instruction and protect the health of their community are often being denied the social distancing and capacity restrictions expected and mandated elsewhere as people gather. As one Connecticut doctor put it very succinctly, to put it mildly, I'm afraid for the next week. With surging infection rates and vaccines for the general public not available until after the new year, the state must shift to full-time remote learning until at least mid-January to ensure that in-person learning is a safe strategy for our students and our teachers, not an experiment, not a gamble. Our number one priority must continue to be the safety and well-being of our students, educators, and other school staff, and the families to which they return every evening. Thank you, and I think you're introducing the next person, right? Thanks.
Thank you, Jeff. It's wonderful to be able to partner together on an important effort. Next up, we have Cynthia Ross Zweig, a local union president and the head of CSEA SEIU Local 2001 Para Council.
Good afternoon and thank you, Mary. As Mary said, I am the Paraeducator Council President at CSEA SEIU Local 2001. As we all keep reiterating, in-person learning is best for our students, but these unprecedented circumstances force us to consider an alternate path of learning to ensure the health and safety of everyone, not only staff and students, but families as well. Last March, school employees joined together to petition the state to set guidelines that would standardize employee safety and thereby student safety. Cohorts were created to limit cross-interaction and ease contact tracing, but in reality, cohorts just limit students, not staff. Staff are still moving from group to group and from room to room with a potential ignorance to science. Transitioning to remote learning, should a town's COVID infection rate climb to the red zone, was also critical to flattening the virus spreading. In the spring, the infection rate declined. Everyone understood remote learning was for the common good. But now, the entire state is in the red zone. And many of our districts remain open. Our workers worry, our students and families worry. The infection rate is at an all-time high, 3 times more than at the virus outbreak. So the question is, why remain open? To simply keep the doors open without regard to science cannot possibly be in the best interest of our children. Everyone is susceptible. Staff, students, and unless there are mandatory, consistent, and transparent guidelines, we will continue to learn of more cases and deaths. While we believe in-person learning is best for students, classrooms do not look like they used to anymore. Most parents picture their children in school with fond memories of storytelling and singing and holding hands. Our students are not running around the playground or gathering around the lunch table. Now students are greeted by staff in hospital PPE masks, field, shields, gloves, and gowns. Educators every day face students unable or unwilling to wear masks, unclear guidelines, and insufficient contact tracing. Like every other role in our schools, the work of a paraeducator has drastically changed during COVID. It is challenging, and even the best educators find it demanding. We are highly qualified, trained paraprofessionals who work with students that have a broad range of physical ailments and learning disabilities. We are not babysitters. We cannot be replaced with untrained and unskilled volunteers. That cannot be a solution to keeping the doors open. We must address childcare separately to help parents return to work, but not at the expense and the quality of education. How can we expect those who are unprepared, unguided, and under-resourced to deliver the safe and quality education our students deserve? So today I want to leave you with this. We must ensure that a highly skilled and dedicated school staff of paraeducators, tutors, teachers, bus drivers, and monitors are more able to support students now in remote or hybrid learning and after this pandemic. Thank you.
Thank you, Cynthia. You've been part of this coalition from the very beginning, and your viewpoints are really valuable. Next up, Shelly Davis, my union sister, a fellow local union leader and Vice President of AFT. She's been an invaluable partner throughout this pandemic.
Thank you, Mary. Good morning, sisters and brothers. I serve as president at the Hereford Federation of Paraeducators, AFT, Local 2221. I am also vice president for paraprofessionals and school-related personnel, or PSRPs, with AFT Connecticut. I am here to represent thousands of non-certified support staff in locals like mine across the state. We are here today because every district and local health department has approached reopening buildings differently this year. It's troublesome that we do not have an equitable or transparent approach in keeping schools, students, and staff safe. State leaders should have provided more than guidance and support, but also consistency where it matters to all of us from day one. Right now, infection rates are higher than last spring. The data suggests that for the time being, all education should be remote or at least hybrid. We know some schools in the district have these elements in place. They provide it for reduced risk, more confidence in well-being, and fewer disruptions in education. And we also know that many other districts, this is not happening, and local officials are sticking with hybrid or full in-person learning. This is the problem. I'll close by stressing the importance of transparency and consistency in reporting and responding to COVID-19 cases. Let's look at what just happened in Avon. Their school officials switched to all remote learning after an uptick in cases after Thanksgiving. We applaud those district leaders for putting students and staff health first. Now let's look at what's happening in Hereford, Norwalk, West Haven, and Wyndham, and many other districts where staffing is very short due to infections and quarantine. Their school buildings remain open for in-person or hybrid learning, well past the time they should be closed. How is this equitable or safe for students and staff in these communities? The answer is clear. It is neither equitable nor safe. Thank you.
Thank you very much, Shelly. Your leadership means more to us than you can really know. We'll hear next from Jody Barr, the Executive Director of Council for Afscme.
Thank you, Mary. Good morning. My name is Jody Barr, and I serve as the Executive Director of Afscme Council 4. Joining me today is Council 4 Executive Secretary Stacy Harrison Birdsong. Stacy is also the President of Afscme, Local 3194, representing professionals and related occupations at the Capital Region Education Council schools. Council 4 represents thousands of non-certified school employees in cities and towns across the state. They are paraprofessionals, custodians, secretaries, nurses, cafeteria workers, and bus drivers. Throughout this pandemic, these unsung employees are working harder than ever and at great personal risk to make sure that their kids are all right and safe. We have an amazing community of workers represented here today, and that's what every school is, a community of people coming together where students live, learn, and grow. The 14,000 plus signatures on this petition represent the concerns of their communities. We're asking the governor and the Commissioner of Education to please listen to their voices. Please make sure our school districts follow our recommendations for safe and successful schools. We have a long and hard winter ahead of us. Let's do the right thing by our students and staff. Thank you.
Thank you, Jody and Stacy. You've been valuable allies. Finally, we will hear from Carl Chisholm, President of the Municipal Employees Union Independent, MEUI. Carl, so glad you can join us.
Thank you, Mary. Good morning, everyone. As Mary said, my name is Carl Chisholm. I'm the president of CEUI, Local 511, and MEUI 506. We represent custodials and maintenance workers across the state. Custodials are working under an extreme stressful situation. They are trying to keep schools clean and disinfect while operating below recommended pre-pandemic staff levels. Most custodials are in danger of increased risk of injury or burning out over increased workloads and overtime. In a few districts where staffing is not an issue, custodials are dealing with job security concerns as outside vendors have been brought in to help instead of hiring additional staff. Putting limited board education funds in supervisors and contractors' pockets instead of employees actually performing the work. Due to increased custodials are having to replace some relatively safe chemicals which aren't very effective under current conditions with more toxic and dangerous chemicals in order to get the schools clean in a timely manner. All of this under constant threat of loss of income from the pandemic. Custodials are have very limited protection from prolonged leave due to COVID exposure, and should schools close for an extended period of time, they have no guarantee of income without layoff protection. Thank you.
Thank you, Carl. The involvement of your members has done a great deal for the unity of this group. To sum up, there is no question about the importance of in-person education. Right now, however, educators and support staff are they are always susceptible and sometimes facing unacceptable risks. Let me be crystal clear. We all want to be in schools with our students, in the school buses, in the cafeteria, in the playgrounds and classrooms. We want that without unnecessarily high risks to ourselves and to our families. We want to know that our needs as employees are considered, as well as the needs of our students in the schools. Our families can make the choice to go to remote learning. Our colleagues do not have that option always. We'd like to entertain some questions from the press if there are any. Who has a question?
The governor has placed a high priority on keeping in-person learning open. He argues that the schools don't serve as a primary vector for spread of the virus, and often says that there's no place or few places safer than some of these classrooms. What do you guys make of that whole argument?
Who'd like to take that question? Thank you, Cynthia.
I'll just address that question. Actually, the Center for Disease Control removed the claim that schools were safe from their official website. And that's because students and support staff are safer at home than in the buildings. Every time the governor claims that we are safe, he loses support and confidence from our members and their parents and students. If schools are safe, let me ask you this, then why are we constantly quarantining due to infections and exposures?
Thank you, Cynthia. Any other questions?
It appears that the governor is letting local districts decide how to handle things and to report back. Is that not a good platform? Do you guys think that it should be different? He keeps saying that there isn't just one rule for everybody.
We're looking for does anybody want to answer that? Thanks. We're looking for consistent statewide protocols. What we were promised at the beginning of the school year were recommendations, guidelines, and protocols. What we find is that they're inconsistently applied. And so some schools, if we have those protocols in place and things are working, and it's fine to leave the school open. There are schools where things are working well. But if there are high levels of infection, and Shelly Davis presented a list of the various elements that are mitigating strategies that increase the safety of our schools. At this point, with the levels of infection and without those mitigating strategies, we don't believe schools should be open. And we have not had those protocols enforced.
Is it a fight with the local superintendent as opposed to the governor?
We believe that there is a responsibility for every student. There's an equity question here, and every student and every employee should be able to work without the unnecessary risks. It should not be a local decision. There should be a basis of safety in every district. That's a fundamental thing.
Could I just continue on that a little bit? What we know is that in different places in Connecticut, in different districts, superintendents are under tremendous pressure to try to make sure that every kid is coming into school. We have heard of situations where, for example, students are not wearing their mask, administrators are not ready to send them home. I don't want to send any kid home either, but if they're not there doing what they need to do, then for crying out loud, enforce the standard. The social distancing standard, we started out, and everybody here knows it, at a 6-foot distancing protocol. Where are we now? In some classes, it's down to 2.5 to 3 feet. That is not okay. In other places, it's working. Why? Because they found additional space. They've got more than the classrooms that they had before, and they're working on making sure that all the things are in place. And finally, the last thing that's happening, some sort of testing protocol needs to be in place here, and that needs to be a statewide solution, not an individual town solution. So when all of that is in place, yes, as Mary said, we're ready. We want, I have a Hartford Courant paper behind me there. Thousands of deaths could possibly take place in this state. We don't want to lose a child, an educator, a staff person in Connecticut. We don't want to lose anybody, but clearly we need to do as much as we can to make sure they are on the other side of the virus and still here next year for our kids.
Are you concerned at all about the equity issues that arise in remote learning in terms to access of learning, and also with the mandated reporting aspect of teaching as well, that we saw reports to DCF down, children were exposed to domestic violence when they were at home for longer?
Equity issues for remote learning, especially in terms of DCF concerns. We certainly care about the fundamental safety and well-being of our students. It needs to be balanced for the safety and well-being of our employees. We do not wish to send any child into harm's way, but we feel that there are circumstances routinely in our schools where our employees they are in harm's way. There's a quote here of somebody who does not wish to be identified, who lost a family member due to school transmissions. We are facing school staff becoming ill and unwell and risking their lives in order to be in school. We think that there needs to be a careful consideration of the balance of safety for all the members of our school community.
How are you all delivering this petition?
We have the petition right here. Fortunately, it's not the scroll that was so lovely. We have the names right here, and we are delivering them to Mr. Harris. Thank you.
Thank you.
Are there any other questions? Thank you very much for being here today.
Thank you.
But it represents the feelings and interests of over 14,000 educators and support staff across the state of Connecticut. Teachers, school employees, and parents who feel